What are the long-term effects of marijuana dependence? Have you ever wondered what happens to your body and mind when marijuana use turns into dependence? Understanding the long-term effects of marijuana dependence is important for anyone who uses or considers using cannabis. Marijuana dependence, also known as cannabis use disorder, can lead to a variety of long-term effects that impact physical health, brain function, mental health, and overall life outcomes. First, let's talk about addiction and dependence. About 9% of marijuana users develop an addiction. This number rises to 50% among daily users and those who start using in their teenage years. Dependence means that a person needs more marijuana to feel the same effects, which is called tolerance. When they stop using, they may experience withdrawal symptoms like irritability, restlessness, and trouble sleeping. This cycle makes it hard for individuals to quit. Next, long-term marijuana use can affect brain development and cognitive function. This is especially true for those who start using during adolescence, a key time for brain growth. Changes in brain structure can lead to problems with learning, memory, attention, and even lower IQ scores. These cognitive issues can persist even after stopping marijuana use. Areas of the brain like the hippocampus and white matter, which are rich in cannabinoid receptors, can show changes linked to heavy use. Mental health is another area of concern. Marijuana dependence is associated with a higher risk of developing mental health disorders, including chronic psychosis and schizophrenia, particularly in those with a genetic predisposition. It can also worsen symptoms of anxiety and paranoia, making existing mental health issues more challenging to manage. In terms of education and social life, long-term marijuana use is linked to poorer educational outcomes. Users may have higher dropout rates and lower life satisfaction. Dependence can strain social relationships and affect job performance, leading to a cycle of negative life events. Physical health also takes a hit. Because marijuana is often smoked, chronic use can lead to respiratory issues like chronic bronchitis and increased risk of lung infections. There are also potential cardiovascular effects, such as increased heart rate and changes in blood pressure, which could elevate the risk of heart attack or stroke, especially in those with pre-existing conditions. Another surprising effect is gastrointestinal issues. Chronic marijuana use can lead to cannabinoid hyperemesis syndrome, which causes severe nausea and vomiting. This is quite the opposite of marijuana's anti-nausea properties and can be distressing for those who are dependent. Pregnant individuals should also be cautious. Using marijuana during pregnancy can affect fetal brain development, leading to issues with attention and memory in children. Additionally, tetrahydrocannabinol, the active ingredient in marijuana, can be passed through breast milk, potentially impacting infant development. Finally, treating marijuana dependence can be challenging. Effective treatment often involves behavioral therapies like motivational interviewing and cognitive behavioral therapy. While some medications are being researched, there is no consistent pharmacological treatment available yet. In summary, marijuana dependence can lead to long-lasting changes in brain function, mental health, physical health, and life outcomes. These effects are more pronounced with early and heavy use. Understanding these risks is essential for anyone considering marijuana use or struggling with dependence.